Austin Public Health is urging more people to get tested for COVID-19 if they have symptoms.
The agency announced today it is reopening 2 neighborhood testing sites for COVID, one in southeast Austin, the other near St. John's in North Austin. Leaders say more testing will help catch the virus early and guide other efforts like contact tracing. As KXAN's Tahara Rahman reports, they're also asking for more help in that process.
Now is not the time to let down our guard.
We decided to create our own messaging.
For more than a year, Frank Fuentes and the U.S. Hispanic Contractors Association have been trying to curb the spread of COVID-19 among construction workers.
You can just imagine wearing a mask in the heat. Well, we were doing that for the citizens.
Last year, UT researchers found that construction workers were more likely to be hospitalized with COVID-19. To Fuentes, the local rise in cases is concerning.
For every positive case we call.
Austin Public Health says they're facing a challenge when it comes to tracking cases.
People sometimes they don't want to talk or they don't want to share information that can affect other persons.
Flor Ayala Hernandez with the contact tracing program says some people fear their employers or immigration will be notified. But she says their information is confidential and can help determine which areas need more resources or better messaging.
That's the only way that we can find clusters or what is happening with the community. If people is not sharing this information with us, we are partially blinded.
Fuentes has been organizing vaccine clinics like this one for over 3 months now and may start offering testing again too, as APH encourages more folks to do so.
We will plant roses in the corner of Colorado and 3rd Street. We need to if we know that that will work.
Tahira Rahman, KXAN News.
APH says they had about 50 contact tracers during the peak of the pandemic in January. They say with the decrease in cases since then, the agency transitioned to 12 case investigators, but they also say they will continue to evaluate the needs of the team and they can expand again as needed.
The state has just released its latest numbers on the variant cases here in Texas. As of tonight, there are 587 cases of the Delta variant. That's 185 more cases than last week. But the state's map here does not reflect any cases in our region. And we know from local health officials that 7 cases of the Delta variant have been confirmed in Williamson and Travis counties. However, those cases may be included in the number of cases that are still pending from the state. As of today, more than 5,300 out of the nearly 8,000 cases are still pending. That means state leaders are still waiting to find out which regions those cases belong to.
Right now, there are more than 80,000 active cases of COVID-19 in Texas. That is the highest number of active cases in Texas since May 20th, that is. Our 7-day positivity rate is nearly 12%.
The Biden administration is debating whether they should ask vaccinated Americans to wear their masks in more settings. The Washington Post reporting tonight the talks are in a preliminary phase. They are happening due to an increase in cases of the Delta variant around the country.
A new study suggests the Johnson & Johnson coronavirus vaccine may actually be less effective against the Delta variant. Researchers from New York University analyzed blood samples from people who received one of the 3 authorized vaccines. They found the Johnson & Johnson vaccine was less effective against the Delta and newer Lambda variants. The study authors suggest this may mean that those who did get that Johnson & Johnson shot may need a booster. It is important to note that this study has not yet been peer-reviewed nor published in a medical journal.